Hi guys, this is Marla. I am going to do a quick overview for you as you head into the endocrine system to give you an understanding of the basics of glucose management, type 1, type 2 diabetes, and then the big major complications that we see most often, which are diabetic ketoacidosis and hyperosmotic hyperglycemic non-ketoic syndrome. Try to say that a couple of times real fast. That the HHNS syndrome. We'll get to that. Now, just a quick overview of what I have visualized here. This is a capillary, your bloodstream. A few happy red blood cells floating by, and your glucose are the G. These are some cells adjacent to the capillary. This is your pancreas, insulin, and a snapshot view of a specific cell and what happens there. And I'll explain as we go along. Starting out now with healthy blood glucose management in the endocrine system. What happens when you eat, say, a big donut and a cup of coffee in the morning with a bunch of sugar in it? The blood glucose level will rise. Yes, you'll see your blood glucose level increase. So as your body metabolizes all that happy sugar, or not so happy, your blood glucose levels rise. Now the problem with that is that our bodies like homeostasis, and endocrine is all about homeostasis. So the glucose level needs to get down. The typical glucose level, healthy glucose level, is somewhere between 70 and 120. So to make things get back into homeostasis, we have the pancreas producing what's called insulin. In the pancreas, there are all kinds of different cells, but specifically the beta cells are secretory, meaning they secrete hormones, which are basically chemical messengers that travel through the blood and tell other body parts to do different things. So the pancreas produces happy insulin, and technically it produces proinsulin, which gets converted in the liver. Just know that the pancreas produces the insulin, and that goes to the cells. The insulin travels through the bloodstream to reach different cells throughout the body, where it connects up with glucose receptors and the glucose channels on the body to get things back into homeostasis. So it works like a lock and key mechanism. The key of the glucose unlocks the glucose channels, opening those doors, and all that extra glucose goes inside the cells, thus reducing the glucose levels in the bloodstream back to normal. Happy homeostasis. That's what we want. Now, what happens with type 1 diabetes? The key things to remember about type 1 diabetes are that type 1 is an earlier onset, meaning before the age of 40. Usually younger, but it can run anywhere below the age of 40. And it's genetic. It's an autoimmune disorder in that the immune system itself will physically attack the poor beta cells of the pancreas so that it's no longer able to produce insulin. The problem with that is, in that same scenario, if we back up to the person having their breakfast with a big old donut and coffee and sugar, there's no mechanism to produce the insulin to get the glucose back into the cells or into the cells to get returned to homeostasis. So what happens there is that that patient physically has to inject insulin to get homeostasis to return. So they are insulin dependent. Again, early onset, genetic, insulin dependent. Now, what happens with type 2 diabetes? It's a different animal, but it kind of works the same way in that if the patient or the person has lack of exercise, poor diet, constantly eating breakfast, lunch, and dinner in and out, and a big double-double in the soda, over time, the body gets what's called insulin resistance. Those poor glucose receptors and glucose channels get worn out. They get kind of an attitude. They're just like, well, you're always eating all this stuff. What, do you want us to just prop open the door? Because they're always having to constantly uptake all this extra glucose in the body. So they get what is called insulin resistance, and the pancreas also can lose some of that beta functionality, the function of producing the insulin, so that glucose management mechanism does not work as well. The only good thing about type 2 diabetes is that it is reversible if caught early enough. We can either have the patient, stop eating all these high glycemic foods, do some more exercise, so that they're not constantly in this hyperglycemic state, and we can help the body to heal and maybe regain some of the reception of the glucose receptors and get things back under control. But unfortunately, more often we see patients in med-surg and different units with diabetes, and those patients do need, if it gets to the point where it's bad enough, they do need to also inject insulin as well. Now, what happens if there's a scenario where we have a severe flare-up of either diabetic ketoacidosis or HHNS? I'll go through each one at a time. Now, diabetic ketoacidosis, and this is important to understand, is typically connected with type 1 diabetes. Why? What happens is that same, say for example, that same person, they've got their donuts and they eat the big meal, blood glucose is very high. Oh, I forgot my insulin. I don't have any insulin. Blood sugar will continue to rise through the roof. Now, meanwhile, what if they happen to get stuck where they are? The body continues to metabolize. The cells don't take a break. They keep metabolizing and doing their normal function, and the glucose levels get so low, the cell is unhappy, starts sending out a signal, hey, apparently there's no food around here, maybe we should start dissolving and metabolizing some of these fat stores that we have laying around, and I can get some food that way. So then the body starts to try to metabolize the fat stores in the body, and these little K's are ketones. Ketones are a product of fat metabolism. The bad thing about that is that ketones are very acidic. So this condition, this diabetic ketoacidosis, is hyperglycemic and ketoic acidosis. You have a metabolic acidosis situation that's induced because the cells are starving. Even though there's tons of food available flowing around in their veins, there's just physically no mechanism of insulin present to get things back into homeostasis. So what do you think the treatment would be for this patient? Right, insulin and hydration. We want to get that blood glucose back under control, get them back to healthy homeostasis, get all these ketones out, so we don't have this acidotic condition and the patient is back in a homeostasis state, happy cells. Okay, that's diabetic ketoacidosis. Now, what happens with the HHNS syndrome? And I'm not even going to try to say that one again. But that with HHNS, it's somewhat similar, but it's more common in the type 2 diabetes. The key difference is that there are no ketones present because the cells don't think they're starving. In fact, they've got tons of glucose. There's glucose all over the place. It's hyperosmotic because you got all of this glucose, very high osmolarity in the bloodstream. Hyperglycemic, and we're not talking just 200, 300, we're talking levels of 600 and above. Extreme high glucose levels, non-ketoic, because again, the cells are not screaming for energy. They've got, if anything, too much syndrome. What typically happens with that is that there's some sort of precipitating event, either a trauma or a infection that causes the diabetic patient to go completely out of homeostasis to the point where their they don't have just basic hyperglycemia. They've got hyperglycemia to the point where you've got high blood pressures, the fluid electrolytes are going to be all out of whack. It's not a good situation. This patient needs the same treatment as with the diabetic ketoacidosis. They need hydration and insulin. Insulin to get whatever, there's room in there, get all that extra glucose inside the cells, and definitely a controlled diet. We don't want to make the situation any worse. We want to get them restabilized, treat whatever the precipitating cause of the event was as quickly as possible to get them back into homeostasis. So again, wrapping up, normal glucose management involves healthy insulin and uptake into the cells. Type 1 is genetic damage to the pancreas, where the pancreas is actually, the beta cells are actually destroyed, so the pancreas can't produce the insulin, which throws things out of whack. And then type 2 diabetes is just insulin resistance, or excuse me, glucose receptor resistance. They can't respond as well because they're just burnt out from all the constant hyperglycemic state. And again, diabetic ketoacidosis is connected with type 1. HHNS is connected with type 2. All right, so that is your overview. Please read in detail and start to make some of those connections, understand why things happen, why the diabetic ketoacidosis has ketones and the HHNS does not. Understand those concepts. You know where to reach me. Either email me or message me. Study, study, study. All right, take care.